WIS is a platform. We're all familiar with platforms. We use Google, we use Facebook, we use Twitter. These are digital platforms. So when I say a platform, you automatically think, oh, that's a digital platform. This is far better than a digital platform. This is meaningful interaction as a community on a social interaction level. So it benefits everyone. This platform is for 7 billion people. It has a great opportunity to bring people together, to tackle social isolation at the same time as we grow our economies for sustainability and regenerating communities, from children in the schools with kids to our senior citizens with seniors. We all work together collectively. That's the beauty of this program and this project. It's there for everyone. We've brought it from a tweet to now on the international stage. You know, we've spoken at Davos. We're supporting the Sustainable Development Goals, their implementation in 25 cities worldwide. It'll impact over 100 million people. This is just a start. Where we see ourselves in the future is growing and evolving and supporting communities worldwide in your local community, making a difference on that circular economy model, generating income streams, but then reinvesting it back into the community. But the ownership is with the local community, so it stays local. Good evening, everyone. Gareth Presch, founder of the World Health Innovation Summit, and I am delighted to welcome you to our WIS talk this evening. We're discussing digital health startups in Pakistan, and I'm delighted to welcome our guests from Pakistan this evening. I'm going to start with Amal. If you could do a very short introduction, and then we'll come to Dr. Khan and then Ahmad. Anyone has a question this evening, please do feel free to put it in the comments, and we'll put it to our expert panel. Hi, Amal.
Great. Hi, Gareth. Thank you so much for allowing me to be on this platform. It's such an honor. I'm actually a public health specialist. I did my master's in public health from George Washington University, and I currently work at the Veterans Affairs Hospital in Stanford doing research. Currently in Pakistan, I have my own startup company where we basically provide a platform for young entrepreneurs where they can access resources and mentorship opportunities to start their startups in Pakistan. And for me, research and innovation goes hand in hand. So a lot of people ask me, why did I go from healthcare into startup? And like I said, I feel like research and innovation go hand in hand. And I felt like that was a very important platform to be discussed and brought up in Pakistan.
Brilliant. Thanks, Amal. Dr. Khan, could you give us a short introduction and tell us a little bit about your background as well?
Okay, sure. I'll try to keep it short and sweet. My name is Qamar Khan, and I'm a nephrologist. I'm practicing in the United States. So I work for the VA clinic, but the reason I'm probably sitting here is that I have a passion with this telemedicine, and I'm involved in this telemedicine projects in Pakistan. So I'm trying to work with some giants, and I will probably mention them during our talk, and that's why we are here. And I have been involved in many other things in Pakistan in regards to introducing peritoneal dialysis. I have as you could see in my background, I have a free online medical education platform that I just started. So I'm starting to build like free online lectures, quality lectures for the students all over the world, actually, not just Pakistan. So telehealth is really taking off. So we'll talk more about it.
Absolutely, we will. We'll get into that discussion, and I'm delighted also to welcome Ahmad. He's going to be giving us an insight into blockchain. I'm sure there's going to be a lot of people who have questions around blockchain and what it is and what it does. Hi, Ahmad.
Yeah. Hi, how are you, man? First, I would like to thank you to have me here. Actually, I have a 20 years experience of ICT industry, and since last 3 years, I'm working in a blockchain field. I'm a founder and the CEO of Pakistan Blockchain Institute, who is kind of a pioneer in Pakistan to tell people that what the blockchain is and the other technology that is not only working on a blockchain. I'm a technologist, so I'm working with the 5G, Internet of Things, smart cities, and a lot of things. I'm working on and talk to people about those things. So mainly on a blockchain. So I am an expert who is working on a blockchain, like pioneer kind of a thing. Normally people say here in Pakistan that I am father of a blockchain in Pakistan. I don't know why they say that, but they say that.
Well, that's not a bad title to have. Let me just start with Amal, and let's just go deeper into entrepreneurism in Pakistan, health as well, big opportunities. Perhaps maybe you could set the scene for those who are just listening in, tuning in. Tell us a little bit about Pakistan, the current situation there, and then let's explore the opportunity. And Dr. Khan can then come in and give us some more background.
Sure. No, like I mentioned, my personal background is from healthcare, but when I came into Pakistan, I actually made frequent trips to Pakistan, but just within the past 2 years, I was actually a little bit more on ground with these students in Pakistan, and I had the opportunity to work with universities in terms of, giving talks about research. And when I was observing the students on campus, I realized that a lot of these students had brilliant ideas, and no doubt Pakistan has amazing talent here and amazing skill sets here, but we just have an issue here about executing our ideas and putting our ideas out in the market effectively and efficiently. And so, that's how I kind of came up with the idea of iCOACHu, and I started to really focus in and understand the culture of what entrepreneurship is and startup culture is. And just to give you a little background about Pakistan in itself, that the healthcare here, no doubt it is kind of a struggling period. It's been a very struggling field in terms of the healthcare industry. But along with that, there's been so many amazing innovations in terms of, with students, with, physicians, with, engineers, with healthcare professionals. The innovations here are immense, but it's just really a matter of putting it out there, our technology. And, I think Dr. Qamar would be really good in talking more about telemedicine and telehealth, but I will like to add that, recently during the COVID crisis and even prior to the COVID pandemic, Pakistan has been doing immense amount of work in terms of connecting the diaspora communities with Pakistani professionals. So telemedicine has a huge impact in the healthcare industry in bringing in, physicians remotely into Pakistan, and being able to do some sort of collaborative work, be able to even perform certain procedures, because I would like to also bring out the fact that Pakistan is the 4th largest country that actually sends out our doctors into the US. So the most doctors sitting in the US right now, Pakistan is the 4th country that provides those professionals. So, bringing back that talent virtually is very essential. And I think, Dr. Qamar, this would probably be a good, leeway for you to discuss more about telemedicine and telehealth and how effective that is for, physicians like you sitting in the US.
Sure.
Well, sorry, Dr. Khan, I was going to come to that. I was going to say the brain drain. This is a huge problem, isn't it?
Huge problem. But we are going to gain it. Pakistan is going to gain it soon and is gaining it. I always say that the world is no longer the same as it was 20, 30 years ago. I mean, it's a village. I mean, we are in a big village, and there are no boundaries. And that's where we are, and that's where my passion is. And I think that we can do so much, not just for Pakistan, but for the world. And that's where I am kind of like working with people in Pakistan and people in United States and in UK. We have in our diaspora group some very good physicians who are trying to put all these pieces of jigsaw puzzle together. And we always say that we stand on the shoulders of giants, and that's what I'm trying to do today. So Sohail Chuftai is a like a physician from UK. He's not just a physician; he's a software engineer also, and he is like a genius. So he is the one who has brought telemedicine to Pakistan, and he's working with Punjab government. He has some very successful models. So he has a software company. It's a medical city online. So he has created some software, and then some companies like some organizations like Sehat Kahani is a very successful model, and we can talk about it if we have time down the road. So anyway, so that part is being already tried, and it's working. So that is where the telehealth digitalization is so crucial. And I always say that there are four things that we can really give to the public. I mean, whether it be Pakistan or any other country. So I mean, we give access to the people when we talk about telehealth. We talk about affordability. We talk about obviously convenience. We talk about quality of care, and we also talk about the volume and the capacity that you can see more patients in probably less time, not by cutting corners in terms of quality, but being available and different like areas. So say for example, one doctor has some openings and the other doctor is busy. The patient can be seen anywhere in that network. So what this is what I feel that the future of medicine is. It's actually present, not future. I mean, I have been doing telemedicine in my VA clinic for a long time, and the COVID changed. Everybody knows COVID changed this whole game. So right now, I'm seeing almost half of my patients through telemedicine in the VA clinic, which I'm a nephrologist. So it's all consultations, and then I have maybe 1/4 of the patients coming face to face. We screen them. We're very careful, and then we see some on the phone or talk to them on the phone. But I feel that there are a couple of models that we can talk about. So I'll let I think Ahmad talk. I don't want to take the mic for too long
No,
and bore
no, that's
people.
absolutely, it's absolutely spot on because it's a huge area of growth. Digital technology, £100
Yes.
billion market at the moment, will
Yes.
grow to nearly 600 billion by the time we get to 2026. So it's a
Yes.
huge opportunity.
Huge
Ahmed,
opportunity.
in terms of blockchain technology, please just give the layperson an understanding of what blockchain can do, because I think it's one of those emerging technologies. And the other side, from a healthcare perspective, I suppose when we look to the future around using digital tools and AI, people get frightened when people say AI. It's a case of enhancing our current system. It's not that we're in competition with AI. It's actually that it will be an enhancement of how we actually deliver
Exactly.
healthcare. So Ahmed, from your perspective, tell us a little bit about blockchain.
Actually, what we are going to do in about blockchain here in COVID-19, we made a software which is basically a digital passport. Like if you are vaccinated for the COVID-19 or not, so you will show that digital passport on the airport, so you can check in. If you are vaccinated, you are COVID affected, and anything that is on or your mobile, we have built the POC actually. So let's see where it can land up, right? So this is one thing we have done. Also, when you talk about the AI, then all the things will predict basically when AI comes into the market, like telemedicine. Amal talk about, and the Dr. Qamar has talked about that. AI will predict things. Like if I have a blood pressure today, then in how many years I'll come up with the heart attack. So that will predict that. So that is the road we are going to actually. So this is basically what is going
Yeah.
on
I
at the
mean,
Yeah,
moment.
talking about AI. I mean, this is another area of my passion that I've done a lot of research, and I think that this is where we are heading, giving a lot of control to AI, but at the same time taking advantage of the technology. And I
Actually,
can elaborate more
actually,
on that
actually, Doctor.
if you guys.
Actually, one thing, the AI thing is basically an innovating technology, right? All the
Right.
data has to be saved on the blockchain actually.
Yes.
So
Okay.
so
the
I
blockchain
mean,
will work simultaneously, and all the other technology will change actually.
Right. Okay.
yeah, I mean, there's no doubt that this technology is exponential, and it grows. And I think it's about human willingness to change. It's those who adapt and who are willing to change, to embrace the technology, because there's no doubt AI will create a lot of jobs, millions of jobs. the healthcare system at the moment is a not sustainable system. You know, if you look at the impact of COVID, we can clearly see, look, health is related to wealth. Okay, just look at what's happening in the US, for example, with millions of jobs being lost.
Yes.
Now, if you invest in preventative measures, you'll have a boom in the economy. So that's the future of healthcare, moving from a pathogenic approach to a salutogenic approach, which is well-being. And there's huge growth in that. And the opportunity for the likes of Pakistan and emerging nations is to not fall into the trap of developing huge medical centers, shall we say, but looking into the community and embracing that holistic approach, which then brings an economic growth as well. Please, Amal, tell us a little bit about on the ground, the kind of, shall we say, talent that is there in Pakistan, because last week, believe it or not, our chairman, who's from Pakistan, Dr. Amir Hannan, he sent a message to our group. And he actually said to us, look, guys, we need to get 20 mobile phones, digital technology, to send to young families in Pakistan as a charitable donation. How do we do that? Because what he said to me was, he said to the group, he said that these young women and young girls and in Pakistan, young boys are very talented when it comes to digital technology. You're seeing that on the ground, and how can Pakistan embrace that and also bring that? It's very important to articulate that message to foreign investment so that we drive in the investment. How do we do that?
You know, honestly, it's a lot more of hands-on and a lot of groundwork that's going on right now. Like I said, again, I deal with a lot of the youth, and I actually encourage the youth to work on this, forthcoming technology. Like I said, again, telemedicine is huge here. There's a lot of investments going on already in terms of telemedicine. But I mean, in terms of foreign investments, there's a lot of, government initiations that are happening. There's a lot of private sectors that are working on this. There's a lot of, public and private hospitals that are working on this. And, just to name a few, ways that we can have this type of connectivity between, the diaspora community or even foreign investors coming into Pakistan. There's one initiation that just started by the health ministry in Pakistan and also public-private university. It's called Yare Watan, which basically means Yar, which basically means friend, and Watan, which means country or nation. And basically what they're doing on that platform is that they're allowing, foreign investors and foreign talent to come into Pakistan and actually provide some sort of, lessons or some sort of training platforms where we can actually teach our health professionals here, and we can work with health professionals in foreign countries as well as over here to, kind of have this cross-collaborative teamwork and association going on. So, I mean, that type of stuff I'm very big on. When it comes to finances, again, there's so many different outlets for that. I'm not one to really speak on behalf of investments. I'm more about bringing skills into Pakistan and bringing this type of networking opportunities in Pakistan, because I honestly, personally, what I've witnessed is Pakistan, we have the money to do this type of work. It's just a matter of finding networking and giving the youth the opportunity to actually showcase their work outside to foreign, companies or to foreign associations.
Absolutely. And also for Pakistan, I'll come to you, Dr. Khan, and also for Pakistan to, start their own companies, because value creation is very important. And it's so important as well that, it's not just hived up, shall we say, by certain corporations, that it's dispersed, and also other people have an opportunity to grow, based on their ideas, so that their ideas. Dr. Khan, one of the areas that I wanted to put to you about the diaspora of Pakistan, that's probably a very unique opportunity if you talk about the export of doctors. And remember, doctors are highly educated individuals. That's probably a huge opportunity for Pakistan to actually connect around the world to bring back opportunity as in investment, but also then export these local talents.
Yes, indeed. Yes. So I mean, it's like it's a two-way traffic, and let me just add on to what Amal said that we have this our like population who is who's young. I mean, most of the people are young and they are very tech savvy, and that is a very plus point for our nation. And then I mean even a grandma maybe using a cell phone or like a smartphone, and then that becomes a very plus point. Then the hindrance or problems that we see is the presence of, say, for example, network, like internet availability. So those are the things that government should be working, and there may be some private companies that can get in, and then they can kind of like try to get these networking or internet availability. And as you asked about the brain drain, I mean that's exactly, I mean we can go both ways. We can have like people being trained in Pakistan, like nurses and other staff, and they can even go to other countries to kind of get more training or even work there, and then bring that education back to the country, just like us. So we got trained, we got. I've been in United States for 30 years, so now it almost, I feel the pull that my son is in medical school, he's about to finish, and so I just, and it's such a great time that I can do, or we can do so much for our country or for anybody. And that's my one thing, that I really believe in, not countries. I mean, I believe in humans, helping humans, and that's what I'm trying to do with so many of my initiatives. And so I'm big into education. I have a street to school that I try to get the kids on the school who are not even going to school to the school by monetary incentivizing the parent, or to kind of like not send a child to child labor. I mean, so that's another big problem. So I'm just going a little off here.
No,
So
no, that's very relevant.
yeah. So coming back to your question is that somebody asked me that when are you coming back to Pakistan? So I mean, I think that I'm back already. So I believe me or not, I'm not kidding. I spend about 15-20 hours every week about with all the work that I'm doing right now from my studio. This is my studio. I have like all kind of things here, like camera, light, and so I am doing Zoom meetings, and I'm doing a lot of things. So speciality. So say for example, the primary care is everybody knows that you can see a doctor, but now this is the time that you can see a specialist. So we can up our game. So the primary care in Pakistan, say for example, in Pakistan now, when they are stuck, they don't know what to do. Then they say, okay, go to see a specialist. But why go and see the specialist? Why not just like you can just refer like through telehealth? So I see all of my, not all, like about, as I said, about 75% of the patients with on telephone or telehealth. So why not Pakistan can also do the same thing? So the sky is the limit, and that's where I think that we should be heading.
Absolutely. And we've got quite a few questions coming in now,
Yeah,
nicely as well.
I hope they are easy questions, because this is the first time I'm going live, so I don't want to get embarrassed.
No, don't worry about that. But let me just come to Ahmed, because one of the things, and the questions come in here, this is really technical, and it's not technical, I suppose. AI and machine learning is overwhelmingly designed by males. So you have biased, So one of the papers I was reading actually last week was about biased AI, and the ethical side of things. Perhaps maybe you could explain that, or is that just something that we need to tackle? I'll just put that to you quickly.
Actually, in Pakistan, we are welcoming girls like Amal is here. I met her for the first time in the conference. So she's one example. So our president's program, the PIAIC, is running, and a lot of almost 30% are girls in that. So we have the innovators in females as well. So by the way, my daughter, I told Amal that some day. that my daughter is
Yes, that's worth sharing.
my daughter, she's 13 years old now, and she is the youngest blockchain certified expert from US, right? So, so we have the innovators in the females. That is not a biased thing. So we have female architects who are working. We have the female project managers who are working here. So that is the not the image normally we see the news in about Pakistan. There are a lot of things happening here.
I suppose that there's a point being made that this leads to many biases and issues around women's healthcare and how can we address this. And I suppose that's really comes down to, like, we have an initiative over the next couple of days, and 16 days activism around gender-based violence. And I suppose that's all about equality and making sure that we give the next generation, females, males, also the opportunities that are out there. Because one of the things I wanted to say was, at the recent World Urban Forum in Abu Dhabi, for example, everyone around the table said, look, there is money there for investments. It's not a case that there's a lack of investments there, but they are there. But we just don't have the mechanism in terms of the projects, because a lot of the projects don't come forward. This is part of the problem with entrepreneurs, and having been through this myself as well. Very difficult to actually get, traction, in terms of, but if you have a good idea, just stick at it, and then eventually it gets its traction.
True.
Amir has come in.
I would like to actually add on to the female perspective about this, is that, no doubt that, in the forefront, we see a lot of men and a lot more male dominance in, the engineering, IT field, even in healthcare. Unfortunately, I will give you a little, just a small background that many female students are actually some great doctors as well in Pakistan and outside of Pakistan. But unfortunately, because of some cultural and social norms, after they get married, they stop practicing. But, I've also noticed this immense boom that, because of the invention and the, accessibility to telemedicine. Again, I'm a huge supporter of telemedicine, because female physicians are now actually able to, practice from their homes as well, in terms of, and coming back into the league of, taking dominance in female healthcare positions. And, a small note as well, I actually went to a smaller city in Pakistan recently. It's called Bhavalpur. And I was amazed that if there were 10 men that were sitting in a room filled with engineers and IT professionals, out of those 10 men, there were about, 4 to 5 women as well that were sitting in that room. So, I mean, still, it is a male-dominant field and a male-dominant industry, but no doubt women are no less, and they're actually performing, head-to-head with men as well. We might not see that in the industry, but I'm telling you, I'm a big woman supporter, and this is also why I kind of did this platform, because I want to empower women, and I see some success stories in the healthcare and the IT field as well.
I just want to add a quick thing. You raised a very good point that women doctors, I mean, there's a problem in Pakistan and many other countries that the women doctors, they graduate and then they go home, they sit at home, they don't work. So about 80%, I mean, seriously, I shouldn't be like very definite. I think it's a big percentage, 70-80%. They stay home. So those are the doctors that we can mobilize. They can work from home. They can do telemedicine because they have families to take care of.
Exactly.
So they want to stay home, and then we can provide them with a short, say for example, a refresher course, and then we can bring them back in the game. And that would be such a big. We have to get rid of the quackery. That's another problem in underdeveloped countries, that we have like quacks, and yes, I'm sorry that you just cannot practice. But the problem is that you cannot practice, but you have to give an alternative. Unless we give the alternative, at least they have somebody. So somebody who's messing up the cases. So that's the problem.
I have 2 doctors in my house. Actually, 3 doctors. My brother, my sister-in-law, and my mother. Everybody's practicing.
Yeah. So that's good. That's very good.
But I think also it's a case of the health systems as well need to be more flexible. I think I've been involved in healthcare system design for many years, and You know, when I moved to the UK, I was involved in some recruitment drives, and I was actually quite shocked at some of the draconian ways of thinking, shall I say, in terms of women's empowerment and engagement. Really did shock me. And I think what we have to do is just call that out. And also then we have to provide the amenities and the support packages that are there to allow women to have children and to come back into the workplace when it suits them, because they add huge value. Also, they are looking after our children for the future. So, you know, we have to also put a practical head and common sense around a lot of things. So I just wanted to say, Amir had put a question in here, and I come to you, Ahmed, about, you know, currently 48% of the population in Pakistan has access to the internet. That's 78 million people are internet users. That's, you know, more than the whole population of the UK, for example. You know, that's a huge opportunity to encourage people to connect, engage, and empower.
Actually,
and I suppose, go ahead.
Please continue. Okay. Actually, internet is not an issue right now in Pakistan, what I think, right? Because we have a very good internet and at a very good price. But something, the problem, if somebody say that is the adaptability. Because people normally think that when they visit a doctor, he will check more accurately. I don't know why it is.
Yeah.
Because I might be technologist, so I see the other way. Because I am not attending somebody. If I want to talk to some doctor, or even though I have at home every doctor, but if I want to some specialist I want to talk about, I can just call him on a WhatsApp, a video call, or a Zoom. You can say a meeting. So
yeah, I would like to address that.
Yeah, sure. So basically, the adaptability is the issue. What I personally think, that we normally think that I want to visit. Like you see, normal people when they like before COVID, when we talk about the meetings, everybody want to be in a meeting room. So
Yes.
they want to visit, right? So after COVID, now I am working from home and something like this. So actually, this is the thing. So if we not going to adopt the things, then somebody, some other thing came and he'll ask us to adopt.
Yeah. So I would like to make a comment before I forget. I'm getting old, I guess. So the thing is that we have myths, and we have, so not everything is good about telemedicine. Let me just clearly tell you. I mean, yes, it has its limitation. If we are sitting here and just like praising the telehealth, that's not right either. But I tell you that there are a lot of myths. So the myths are that unless a person or doctor touches your pulse, then he or she cannot really give you a good care or diagnosis. I tend to disagree, and a lot of things can be nowadays. I know that we are still behind. That we will not have a Apple Watch that can do an EKG for you, and then there are like some devices that can listen to your lungs while you're talking to the doctor, and there are so many software. But at the same time, we have like 2 or 3, and that is where what I wanted to just tell the people who are listening to this program, that there are different models. So say, for example, one model is patient is sitting at home and then connecting to the doctor. Very easy, simple. But second is like the villages and the small towns where there are no like internet, or you have limited internet, limited phones. So then there are clinics which are run by maybe technicians or maybe nurses, and then the doctor is available there. So the people go there, instead of seeing a quack, you can see a doctor there, and then the doctor will communicate, and that is another way of like kind of seeing the patient, and that's where I think we need to understand the limitations, but at the same time, the software should remove the barrier. So when the patient is talking to the doctor, there's no software in between. It is all like you and me talking, almost like touching. Almost you can even touch the patient. But I'm just giving you an example that this is how good it should be, and it will be that good. And in some areas, it is already that good.
But I think this comes down to health education, you know, and health literacy, and people being able to navigate and understand how to manage their own conditions, for example. I mean, there's such a misconception. I'll come to you now, Amal. I know there's quite a few people trying to get in. But I just wanted to make the point because Dr. Khan's made a very important point about understanding here. If, for example, there's such a misconception around public and private healthcare, for example, if you feel that, you know, you get paid for something that you get better care, better standards, that's not necessarily the case. There's such a misconception around that, you know, so, and people realize here, you know, you're medical professionals, you'll know yourself that the highly qualified public health specialists are the ones, if there's any problems, that's where you get rushed to. You get brought to your clinical center of excellence, you know, where the training happens. So there are a lot of people don't understand that in terms of how you navigate the system. I'm conscious of just to say, I'm conscious of the time at the moment. So one last question to each one of you over the next few minutes. How do you feel the next 12 to 24 months will evolve, and what are the opportunities for Pakistan? And I'll start with you, Dr. Khan.
Yes, sure. Well, I hope I give some time to Mr. Ahmad, and just quickly, I'll try to give you a capsulated answer. So right now we are trying to evolve this telehealth and trying to spread, because Punjab, say for example, this is the biggest province of Pakistan, has already employed Medical City Online to provide telehealth to the province. And now we personally, like I'm representing right now, say for example, Empower Pakistan, that we are working with this Medical City Online, Dr. Sohail Chogtai, who is a doctor in UK and a software engineer. So he's now taking it to Sindh. Sindh is another province of Pakistan. So we are helping him to kind of get this telehealth to a very big healthcare system in Sindh. So this is where I am seeing this evolving. I'm just seeing it like blossoming. I mean, blossoming is not the right word, but this is where, and it is. My first sentence should have been in this talk, that is healthcare a right or a privilege? So that is where I think we should start from. The healthcare is a right, and I tend to, and I'm working in the United States. I've written an article here that U.S. healthcare is probably one of the worst among all the developed nations. We are the biggest spenders. So you said just a few minutes ago that not spending money or doing a lot of tests does not mean a good care. So this is not good care. So we want to give good care to the patients and good care to the people of Pakistan.
Absolutely. I mean, you know, one of the things, the US spends over $3.5 trillion on healthcare, but its outcomes are pretty poor. So this is something that we have to recognize. Amal, you've been really wanting to get in there. Please tell us your point, but then also give us some hope for the next 12 to 24 months.
Honestly, coming back to the education part, and I guess that ties in very well, because being a public health specialist, I am a big endorser about education and prevention. And I think the best way to prevent, such pandemics and such crises during pandemics is primarily education. And I have to say that I have been in Pakistan. I didn't even get a chance to go back to the US to understand the dynamics of what's going on in the US in terms of the COVID. I've been in Pakistan throughout the COVID pandemic, and honestly, I have to applaud. Pakistan has done an immensely incredible job in terms of educating the locals, and that goes from the most upper class civilians to the lower class civilians, because in terms of education and in terms of public health, the information has been there. It's been going out, it still is, and when we're calling, when we're making phone calls, we don't have normal bells. They're actually giving us an entire, precautionary message that, it's Corona, make sure you be preventative. So the preventative measures and the education is there. And in terms of the internet as well, the internet usage is completely accessible to the upper class, to the lower class, to the middle class. It's there. It's just a matter of people availing those opportunities and actually taking advantage of getting that information. So, my biggest, hope, or actually I'm very hopeful about Pakistan. And I know that the first session of the COVID that we went through, Pakistan handled it in a very, applaudable way. The whole world actually took acknowledge of that. The second wave that we're in, unfortunately, people have learned to kind of adapt to the pandemic. So, the numbers are rising worldwide. It's not just a Pakistani issue. But, all I would like to say is that Pakistan, in terms of the crisis, has done really well. It's just a matter of our people really taking the initiative and the precautionary measures that are needed. So.
Absolutely. And it's also, it's the wisdom, isn't it? It's passing down the generation of wisdom. How do we share that information, and maybe digital technology, for example, this is recorded, it can be disseminated all over the world.
Exactly.
It can be shared to future generations. The most important thing is to have, we talk about smart cities, but we need smart citizens, Ultimately, it's about how do we help each other? How do we share that knowledge? Ahmed, the last point to yourself, next 12 to 24 months, I've been read into, I was reading today about the influx of, shall we say, finance investment into Pakistan. Is blockchain going to become one of the hubs? Is that going to be one of the areas that Pakistan will thrive in, an AI hub, for example?
Hopefully. Actually, next 12 months, you can say 24 months, how it will work. I personally think that technology will take over a little bit, and people like I have given the idea like in 2013 to the government that they make health centers at the multiple places, like in villages and these, so we can use this telemedicine thing, right? So doctor is anywhere, and it will. So I think the government will work on this on now, maybe. So because that's important for us for the COVID to that social distancing and everything. So let's see. I think the technology will take over these things.
I think you're right. And just as there is a project, you're probably aware of this, Dr. Khan and Amal, you're probably aware there's a project iCOACHu out there, which is used for complex needs, for example, Hep C and so on treatment, which is disseminated then into GP primary care practices. Take a look at that. It's an excellent example of how digital health can work. I believe definitely technology, startups, the whole lot will come to the fore, giving startups the opportunity to share their knowledge, share their ideas and solutions, and to scale them globally is what we really have to focus on. That's hopefully what the WISP platform in early next year, we want to launch, a startup platform where we work with our cities, but we amplify those solutions into wider audiences so that they can be scaled. That's really what we have. Final point I will make is just around when you talk about AI and digital coming along. We also have to remember nature. And I think one of the most important things we can do is actually plant trees and get out and help our environment. That's something that we can do ourselves, which can also bring huge wealth. There's also the capture of carbon credits. And we're working on a project at the moment around disseminating, planting trees, but also then providing an income and a job for those who need that. So listen, for this evening, I'm going to call it a day. We'll close the session. It's been fantastic. I'm very grateful for your time this evening. I know it's very late in Pakistan. And I just want to thank Amal, Dr. Khan and Ahmed for their time. And I'm sure we'll have you back online as well in the future. So it's goodbye from everyone here and good night, everyone.